I'm good. Tell me about yourself.
I'm a strong, young, hardworking young woman. I enjoy taking care of others. You could say that my passion is my job. Nursing is my passion. I enjoy helping others get well and becoming healthier people.
Why did you choose nursing?
I chose nursing because it brings a lot of different challenges in my everyday work life. I enjoy learning new things and allowing myself to grow in my nursing career.
How would you respond to a patient who constantly demands pain medication?
I would listen to my patient's concerns about their pain and tell them that I'm doing everything we can to help them relieve their pain. I'll also check the medication administration to see what type of pain medication they are receiving. Also, I'm going to look and see when the last time they had pain medication and to see if that pain medication is working for them. If not, I'm going to notify their provider and their care team to see what other options we can do to relieve their pain.
How do you accomplish a lot of work in a limited amount of time?
I'm going to organize my time wisely so I can prioritize the tasks for each patient. So I would organize the most emergent needs first and to the least emergent needs of a patient.
What are your educational goals?
My educational goals is to be transitioned into a registered nurse and graduate with a bachelor's degree and eventually graduate with a master's degree in nursing.
Where do you see yourself in 5 years?
I see myself being a registered nurse and having my bachelor's degree. Also, I would really love to work with pediatrics or obstetric unit.
How do you handle stress on the job?
I handle stress by organizing my time wisely and allowing my time management skills to really show and not being overwhelmed by my workload.
What are your strengths and weaknesses?
My strengths and weaknesses, my strengths are my ability to communicate with my patients. I'm very flexible in my time, and I have some computer skills. I also really work well with others and enjoy the team efforts. And being my patient's advocate is the biggest thing in my nursing career. I really love. My weaknesses is the lack of clinical experience in the hospital because due to the COVID-19, I had limited amount of time in the hospital for my clinical experience there.
Tell me what you feel is your greatest skill as a nurse.
My greatest skill would be communicating well with my patients and their families, allowing them to be informed of their care that they're receiving, and also being my patient's advocate is the biggest thing, so I can express their concerns of their care to the providers or care team.
How do you deal with a patient that is not satisfied with their care?
I will listen to my patient and see what their complaint of their care is, and I will identify what the problem is so I can help them solve and eventually get them to the satisfied care that they need.
Are you comfortable working with other doctors and nurses?
Yes, I love to work alongside other care team members. They allow me to see the different visions and mindsets that they have. Also, it sets me up to experience how others do their job and how they organize their time.
What do you find is the hardest part of being a nurse?
I find the hardest part of being a nurse that my patient is in pain. I don't like seeing my patient in pain. So I try to be positive when I'm in the room with my patient. I try to be sympathetic towards their pain and compassionate, so I can provide compassionate care. And I try to be strong for them so they can see that they will eventually get better.
Why are you the best candidate for this job or for this position?
I've had experience working in a long-term care facility with as a certified nursing assistant for 2 years, and I have been a personal caregiver for the past year, taking care of someone that has cerebral palsy, and he needs 24-hour care. So that allows me to have experience dealing closely with different patients that need different types of care. Also, being a nurse is more than a job to me. It's a passion of mine. I enjoy taking care of others and seeing them get better as I help them. Also, I enjoy the challenges that this job brings, and I like to learn new things. So anything that comes up that is new, I like to learn about it and see if I can incorporate that into my care.
What type of supervisor do you appreciate?
I appreciate the type of supervisor that works well with others, is a team player. Also, a supervisor that is helps you with patient care, helps you understand things that you don't understand in the hospital, either with the policies or with medication order that a doctor has put on. I really like a charge nurse or a supervisor that really explains things that I don't understand.
Why do you want to work here?
I want to work here because I enjoy the positive and uplifting working environment that I feel and see. I also like the team effort that the co-workers have put around here. They help each other, they make sure everybody is doing good, and making sure they're on top of all their tasks. It is this would be a very good opportunity for me to experience different roles that each other plays.
Tell me about a time you've worked with a difficult coworker.
There was this one time that I had asked a coworker for help moving a patient in bed, and they refused me because they said I needed to learn how to work on my own. So I told her okay and politely walked away, not making a big scene, just then asking for somebody else to help me that was more willing to help with moving that patient.
Describe a time when things got hectic, and how did you handle it?
There was this time when I was working during Hurricane Irma, and it was my first week on the job, and I was by myself for the first time as a certified nursing assistant, and I was in a room with a patient, and the lights went out, and the patient kind of got a little scared. So I comforted them and made sure I was calm, even though inside I was very uneasy about the situation, and plus trying to calm them about the storm and telling them it's going to be, you'll be fine. But handling that situation, I feel like in a crisis, either a hurricane, I can remain calm and encourage my patients and calm and console them basically to feel safe in my care.
Tell me about a time when you effectively educated a patient.
I effectively educated a patient by the patient wasn't wanting to turn wasn't wanting to turn and wasn't wanting to drink water. They just didn't see the need in turning or drinking the water. So I explained to them how turning every 2 hours reduces the pressure sores that could come up onto their back or bottom, and reduce more pain also with that comes with pressure sores. And I encourage them to drink water because it will make sure that they don't get dehydrated. Also help reduce the risk for urinary tract infections.
Have you ever caused any conflict?
Not that I'm aware of.
Tell me about a time when you had to persuade a patient about something.
I persuaded a patient one time. They were not willing to take their medication for the nurse, and so I encouraged the patient that the medicine will make them feel better, and that I would give them another pudding cup, that making sure I could give them another pudding cup from the nurse, obviously, but I made sure, it's like, if you take this medicine, it'll make you feel better, plus I will get you another pudding cup to help with that process, help with the medication, actually. So